Community members in Dekabusa belong to various groups. Most of these are built around self-help initiatives such as savings, burial, health insurance, and farmer groups, among others. These groups bring people together. They bind them through social norms and promote certain behaviors such as the savings culture. But Dekabusa, and indeed many parts of Luwero, continue to grapple with health challenges. One of these challenges is the burden of syphilis.
When we made that attempt at community health profiling, syphilis came as number 2 after HIV. Number 2 among the health concerns, and among about 8 concerns, big health problems to the community.
Can these groups also be used to address the syphilis malady?
First of all, we need to identify the organic communication system. How do they get to know about how to address illnesses? What communication system informs their health behavior? If we can use that same, infiltrate it with correct information, then the behavior may change.
That is where it starts. Understanding what the community perceives this to be. If we know what the community thinks about this and everything that you want targeting syphilis, and you also try to understand their fears, why people don't seek care. If we engage the community and try to understand it from the community perspective, then I think we shall be able to design messages that the community understand and relate with.
Health services at the government health facility in Kasana, Luwero, are provided, but utilization of these services is still low.
The government has a program for screening syphilis, and we screen these mothers at any time when they come to hospital. Usually the best is to screen them in the first trimester or early second trimester. But whatever time a mother comes to hospital, we have a program run by the government where we screen all these mothers. So if a mother comes for antenatal care, that is a service that we give them. And if we identify that a mother has syphilis, we actually go ahead and treat these mothers. The challenge is that this care is not different from all the other things that run in the hospital. So like all the other things, we have shortages where you can have mothers coming to hospital during antenatal care and you actually don't have the test kits in the hospital. So we miss the opportunity to screen these mothers and be able to give them a service. Then you have mothers who actually never come to hospital, or mothers who come very late when you cannot really give an intervention. She comes late in the last trimester. If this mother had an infection like primary or secondary syphilis early, by the time when she comes late, sometimes you already have effects on the child, or sometimes she has already lost the baby. You can't really intervene early.
Many people in Dekabusa believe they have syphilis. Why have they not sought medical help?
We even don't know if what they talk about is syphilis, actually. Because the perception of any illness that gets complicated becomes syphilis. When you develop a skin complication that is not well, because of course diagnosis of illnesses like skin and some complicated illnesses is not infrastructurally placed. I mean, in the community you have no infrastructure to detect these illnesses. In the end they become syphilis. So you have a collection of treatable illnesses or infections, call them, in the community not being addressed because the community has labeled them as syphilis and therefore difficult to treat or impossible to treat, that you can only have symptomatic treatment.
Stigma and other factors take their toll. The public health burden of untreated syphilis is staggering.
In the first and second stage, that's when the mother is actually infective. That's the infective stage where the mother can actually pass on disease to her newborn. In the latent and tertiary stage, it's basically effects that are to the mother. So if the mother gets pregnant and she's in the primary or secondary stage, then she'll pass on infection to her newborn, to her baby. And this usually occurs after 14 weeks, that's after the placenta has formed. Yeah, because this transmission occurs across the placenta. The effects are really varied, and they range from early pregnancy, where the mother can actually lose her pregnancy. You get a miscarriage or an abortion. Many people call it miscarriage. You could have just intrauterine fetal death. Your child just dies, stops moving in your stomach. The child just doesn't move. You can also have issues of early labor. Syphilis can cause you to have labor before the 37 completed weeks. Then you have a preterm baby who is difficult to manage and has special complications. Syphilis is actually known to be a major cause of what we call stillbirth, death of children after 28 weeks of pregnancy, but also before delivery, that period from 28 weeks to delivery. If the child does not die and you don't lose the pregnancy, you don't have a preterm birth, you also have a child who is born and the children die early. If they've gotten syphilis congenitally, they can die early. But some of the children actually survive. They don't die in that early neonatal period. They go on to grow with this infection, and some of them get it early in the first 2 years, what they call early congenital syphilis, or some of them get it later in the early life, in the first 10 or 20 years. They can actually start having a few complications from syphilis.
Every year, at least 500,000 infants are born with congenital syphilis. In addition, maternal syphilis causes another 500,000 stillbirths and miscarriages annually. Yet, with the development of reliable and simple tests, the disease could be easily screened and treated early in pregnancy.
I think it all starts with the sensitization. Show them that actually there is hope. They can be screened early if they seek care. Tell them where the care is, and tell them that actually they can be cured of this disease, so they can save a life for the mother and the baby. So I think we need to raise awareness. That is where it starts.
Communication and changing the mind, addressing the mind is the first step. And then you bring in accessibility of these health treatment technologies. Is the medicine there? Go for tests when you have this illness, when you have this symptom. Will the test be there? Because the challenge on the ground is, you tell us to go to health facilities, but do we get the treatment when we go there? Or can we access them? Some of them are a bit far.
Although treatment for syphilis is cheap and effective, access to treatment is difficult for many people living in rural areas. You can get syphilis by direct contact with a syphilis sore during sex. Syphilis can also be spread from an infected mother to her unborn baby.
In a primary stage, you have an ulcer, which we call a chancre. That area of ulceration, that point is a wound where the organisms will actually move out from.
Syphilis has been called the great imitator. because it has so many possible symptoms, many of which look like symptoms from other diseases. The painless syphilis sore that you would get after you're first infected can be confused for an ingrown hair, zipper cut, or other seemingly harmless bump. People who have early syphilis infections can more easily spread the infection to their sex partners. The non-itchy body rash that develops during the second stage of syphilis can show up on the palms of your hands and soles of your feet, all over your body, or in just a few places. You could also be infected with syphilis and have very mild symptoms or none at all. Symptoms of syphilis in adults can be divided into stages. During the first or primary stage of syphilis, you may notice a single sore, but there may be multiple sores. The sore is the location where syphilis entered your body. The sore is usually firm, round, and painless. Because the sore is painless, it can easily go unnoticed. The sore lasts 3 to 6 weeks and heals regardless of whether or not you receive treatment. Even though the sore goes away, you must still receive treatment so your infection does not move to the secondary stage. During the secondary stage, you may have skin rashes and/or sores. This stage usually starts with a rash on one or more areas of your body. The rash can show up when your primary sore is healing or several weeks after the sore has healed. The rash can look rough, red, or reddish-brown spots on the palms of your hands and or the bottoms of your feet. The rash usually won't itch, and it is sometimes so faint that you won't notice it. Other symptoms you may have can include fever, swollen lymph glands, sore throat, patchy hair loss, headaches, weight loss, muscle aches, and fatigue. The symptoms from this stage will go away whether or not you receive treatment. Without the right treatment, your infection will move to the latent and possibly late stages of syphilis. The latent stage of syphilis begins when all of the symptoms you heard earlier disappear. If you do not receive treatment, you can continue to have syphilis in your body for years without any signs or symptoms. Most people with untreated syphilis do not develop late-stage syphilis. However, when it does happen, it is very serious and would occur 10 to 30 years after your infection began. Symptoms of the late stage of syphilis include difficulty coordinating your muscle movements, paralysis, numbness, blindness, and dementia. In the late stages of syphilis, the disease damages your internal organs and can result in death. How will my doctor know if I have syphilis? Most of the time, a blood test can be used to test for syphilis. Some healthcare providers will diagnose syphilis by testing fluid from a syphilis sore. The results of a 3-year research study conducted by Makerere University, Kampala, and University of Amsterdam should inspire communities in Uganda to adopt the results and use them to help deal with syphilis.
Every other day you see children die, you see mothers coming with miscarriages. And sometimes we are not taking that extra mile. We are just on duty working, like running through, and we're not analyzing the data that we have to try and understand problems.
The study is part of a project to identify and develop sustainable health resources in poor community settings in Uganda. The study is an attempt to use pre-existing groups in Dekabusa as a strategy to improve people's health.
We need to take this on as a surveillance system, really, for us to analyze and understand this burden, because it's only when we know that we can focus our efforts and increase understanding of those who do the service delivery. And because I think if syphilis is given all the attention it needs, given the burden that we see, given the effects that we see in mothers and newborns, then we shall have what we need to deliver this service. Like always have test kits and everything that we need to screen. I know that there are so many diseases actually that have been given attention, but syphilis actually contributes a bigger burden than many of those diseases.
If boosted with locally available technical and social support, these groups can be powerful agents of change for better community health. The aim of the study is to increase utilization of existing formal health services, with particular focus on syphilis screening and treatment. This will be achieved by, among other things, arranging with the health facility to provide special clinic days for the communities. The concept is based on a theory of change, that the power of group norms can be used to cause behavior change and improve people's health.